Go ahead, Tina, and just show this for a moment. And to flex the leg at the knee joint, she has to engage the hamstring group. The hamstring group is composed of the medial hamstrings, the semitendinosus and semimembranosus, and the lateral hamstrings, the long head and short head of the biceps femoris. So she is concentrically contracting and strengthening them. Now, if the knee joint goes into flexion, then the knee joint extensors must stretch. Who are the knee joint extensors? The quadriceps femoris group, the quads. Now, so the camera has an unobstructed view. Can you bring this arm out of the way? So the quads are superficial anteriorly. They also are lateral, posterolateral, medial, and posteromedial. But primarily what we're looking at is one of the four quads, and that's the rectus femoris. So to step back for a second, if she goes into knee joint flexion, she stretches all four quads: rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. But the rectus femoris is the only one of the four quads that also crosses the hip joint. And when we put a stretch on rectus femoris, there's tension on it, and that tension will be exerted on its attachments. Well, one attachment is the tibial tuberosity down here, which would tend to want to pull the knee joint into extension, but that won't happen because she's contracting the hamstrings to flex the leg at the knee joint. So the tension will play out at the AIIS, anterior inferior iliac spine, pelvic attachment on the anterior side of the pelvis, and that would tend to pull the pelvic bone into anterior tilt. Now, Tina, keep the arm there. We'll not worry about the upper body part. Just show us the way Joe Pilates used to do it, very vigorously. And when you see it being done this way, you will see that the pelvis goes into anterior tilt each time that the heels approximate toward the buttocks because of the stretch on the rectus femoris. It also tends to create a a force up on the head that tends to push the head into hyperextension, again jamming at the atlanto-occipital joint here. And one more thing is, this is absolutely opposite motions in that if she's going to be somewhat flexing the upper thoracic spine and cervical spine, then it's natural that some protraction of the shoulder girdle, the scapulas, should go with that. If she brings her arms too far back and it starts to push the scapulas toward retraction, it's contrary to the flexion motion. And it's not natural to try to flex up forward and pull the shoulder girdles back. Now, having said that, some people might go excessively the other way and bring their arms too much this way, which would pull the scapula off of the mat and cause too much protraction. So we don't want a deviation too much in either direction. Okay, good there? Wonderful. Now, this is the fourth one in the abdominal series, and now it's a double straight leg stretch here. And go ahead and show the exercise now, the full expression of it. And as she goes down, the hip flexors are eccentrically contracting to slow her down. As she comes up, they concentrically contract. And that is a typical way that we look at motions against gravity, concentric, and with gravity, eccentric. Now just rest down for a moment. Musculature that would bring the trunk, the spine back would be extensor musculature, and that would be, again, the paraspinal musculature, which is a broad name for the erector spinae group and the transversospinalis group together. And we can include other extensors of the spine, the trunk, such as quadratus lumborum. Okay? Now we're going to add to that in just a moment, but let's now go down into that rocking position that people will do as kind of the second beginner phase. Here, what Sam is doing when she's rocking this way, you can picture this is like a sit-up, a curl-up, a crunch. So clearly, we'd be looking at engagement of anterior abdominal wall core musculature to rock forward. You can then let yourself go back with gravity, and that would be just a momentum from gravity. But with this exercise, we normally do not want to roll back too far. We do not want to go past, and go to a comfortable position for a moment here. We do not want to go past the inferior angles of the scapula. So our range of contact on the mat will be from the inferior angles of the scapulas down to where we would be when we're actually in the balanced position, which, as Simona said, is on the sacrum. It would be on the lower aspect of the sacrum, what's known as the apex of the sacrum. And it could be a bit down over on the pelvic bone here toward the upper superior aspect of the ischial tuberosity. But to make a point, not down here on the ischial tuberosity over here, but higher up here across sacrum and pelvic bones. So when she is, go back down to the rocking, so when she lets gravity rock her back, if she would go back too far, then she would actually need to engage the same anterior abdominal wall, spinal flexor musculature eccentrically to slow down her descent. We also have the similarity. Can you go up into the exercise position and let the belly come up? If we see the belly protruding out, we know that she's not holding that anterior abdominal wall down. So as you heard Simona say, scooping. So now scoop down. There, we see that beautiful scoop. Relax on down. All anterior abdominal wall muscles can help to hold the anterior abdominal wall down, but the transversus abdominis is especially useful for that, what's called the corset muscle. So getting that scoop of navel toward the spine is getting that transversus abdominis to engage as we're working to stabilize the pelvis. Okay, so another modification was where she grabs on the lower leg, on what is called the leg in kinesiology terms. So Tina, just on one side with your left side, grab on the leg. And Simona made a point that if they can't reach distal to the knee joint, then simply don't do this exercise yet. It's an intermediate level. There's no reason to force it if they don't have the flexibility. If she can't get over to this point here and she can only reach to here, then they're not ready. And if anything, they might compensate and try to come up more to reach distal to the knee joint, which, as we said, is unhealthy for the thoracic spine. Now, where she reaches on the leg, distal to the knee joint, or even onto the foot, theoretically, the farther she is distal, the more leverage force she will have to hold the knee joint in full extension. And this is really important because this is the crucial difference here between the straight leg stretches in the abdominal series and the other stretches where the knee joint is in flexion. Put the knee joint in flexion for a moment. When the knee joint is in flexion and you bring the thigh into flexion toward the chest, the anterior abdominal wall, the muscles that are being primarily stretched are the glutes. They will be the gluteus maximus and the posterior fibers of the gluteus minimus and gluteus medius. The reason the hamstrings don't get a stretch in this position is the hamstrings are also flexors of the knee joint. If we allow the knee joint to go into flexion, then we slacken the hamstrings and they lose their stretch. Now with the straight leg stretch here, because the knee joint is in full extension, it will be the hamstrings that will be the shortest ropes, in an expression I sometimes use to describe when you have multiple muscles that can be functionally in one group stretched, that the one that is the shortest, the tightest, will be the one that will really stop the stretch and get the benefit of the stretch. So in this particular case here, by having the knee joint in full extension, we target the hamstrings. If she brings her knee joints into full extension and her hip joints, so 90 degrees of flexion at the hip joints and full extension at the knee joints, of course, as Simona mentioned, if you have a typical middle-aged male client who has tight hamstrings, they might not be able to do this, so you never make perfect the enemy of good. You can back off a little bit. But the idea here is the closer that we get the weight of the lower extremities, the thighs, the lower legs, and the feet over the pelvis, the less leverage force there is to hold them there, and therefore the less demand on the hip flexors, And if there's less demand on the hip flexors, there will also be less demand on the anterior abdominal wall musculature, and I'll mention that in just one moment. As the lower extremities start to go down, the center of weight of her thighs, legs, feet moves farther away from the axis of motion at the hip joints. And the farther away that is, the greater the leverage force to hold the position here. And this is an isometric. So can you do that, Sam? Now kind of the final posture where you're down about the level of the shoulders here. This is an isometric contraction of the hip flexors. And now you start to do the roll up. And she retracts back again, the shoulder girdles. And as she reaches forward, she starts to reach forward with her shoulder girdles. And she's both elevating and she's protracting the shoulder girdles here. And that's going to be contracting perhaps pec minor, pec major, serratus anterior. And now we can see if she's dominant with either, let's say, pec minor or serratus anterior. When you see winging of the scapula, where the medial border of the scapula wings away, that's usually a client who's pec minor dominant. And if we see that, then what we can ask her to do is not to reach as far forward. You know, in Pilates, it's always said it's not how many, it's how. It's not how far you go, it's how. We don't want to imprint a poor postural pattern. So we don't ask her to go farther than she can control the proper posture here. The other thing we can do is we can tap on the area of the serratus anterior, which if she protracts from serratus anterior, that will hug the scapula against the rib cage wall and prevent that winging or tilting away, or what's called medial rotation of the scapula. So we both make sure that she doesn't go too far, and we try to cue by tapping over the serratus anterior. So she has that elevation, the upward rotation, and some protraction of the scapula here. Now you go back, and as she goes back, she's starting to retract the scapula, going down, 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 down. She really retracts now, plugging down into the mat, and then she goes back to protraction, and then full flexion here.